Okay. Yes. Okay. Everyone, thank you, students, for joining in this lunch time. I appreciate your enthusiasm, and over to you, ma'am. Yes.
Oh, so in the previous lecture, even Neha ma'am taught you about the engulfment of the transplant hemolytic stem cells, right? So we'll be talking about the principle, procedures, and the collection, how the storage and the donor, while we are taking the sample from the patient itself, from the donor itself, how what will be the criteria and how what will be the process, principle, and the condition therapy, autologous, allogenic. These are the topics we'll be clearing. So let me start with the collection and the proceeding and the storage of the hemolytic stem cells. Okay. So first, you people need to understand what is the goal. The goal is to transfer the hematopoietic stem cells along with the appropriate doses of key immune cells from donor to the recipient. So if I am a donor, if for example I am a donor, I need to donate these stem cells to the person who is leukemia, who has a cancer, who doesn't have the proper immune system to work properly, okay, and their cells are damaged. So what will be the whole criteria? These are the cells which will be involved. Cells types that matter are often measures CD34 plus cells, T cells, B cell, and NK cells. Okay, so these cells which are to be transferred from donor to the recipient. So collecting the hematopoietic stem cells that we call as HSC from donor typically involves a process called emphasis, and here we will be talking about the procedure. How do we collect it? What will be the criteria? What would be the rejection criteria from donor to the recipient, and if whether he is able to donate or not. Okay, same like in blood bank we take the proper ABU grouping, same we'll be doing in this procedure also. So let me talk about the procedure first. Emphasis procedure is during the collection procedure, the donor blood is drawn through a needle from the arm obviously and passed through a machine that separates the stem cell. Okay, the remaining blood components are returned in the donor through a needle in the another arm. The process typically take will several hours and may be repeated over a multiple days after correction of the stem cell. For example, if I'm a donor and I'm donating a stem cell to a recipient, okay, so I need a proper, there is a machine where proper needle will be inserted in the arm, and then these machine will separate the stem cells and it will be donated to the donor. Now, if I talk about the collection, after stem cells are harvested from the donor to the patient, they are progressed in the laboratory to remove any contamination, unwanted components. So, while we are taking the collection sample, we need to take care about the patient, whether the laboratory has removed all the contaminants and unwanted components which we don't need during the procedure. So, cryopotent addition before freezing, and a cryoprecipitant solution is added to the stem cell suspension. Now this is an addition where will be adding a stem cell suspension, is a like a slime. We'll be harvesting this stem cells to the donor. We need to freeze it first. The solution helps to protect the cell from damaging. Okay, and this freezing and the thawing process is preventing the formation of ice crystals that could also harm the cells. So while we have collect the stem cells from the donor, we need to cryo protectant the addition where the proper we don't need the damaging of the freezing and thawing during the process. So here it is a picture where how the whole procedure is being done. This is the donor who is donating the stem cells to the person. Okay, and these are the proper uh proper procedure where we need to take care of it. You can see even the person is handling this ball. It is because the blood should be flow properly. Now, if I talk about the cell processing, now how it is being processed. Once it is being collected, the stem cells are progressed in the laboratory to remove any remaining red blood cell, plasma, and other unwanted components. So we don't need whatever the cells we need. It has to be collected, and rest of the unwanted components we don't need. We do not need it. Okay, cryopreservation. Now this is the fifth step. How it is being processed. The purified stem cells are then frozen and stored until they are needed for the transplantation. For example, if I am a person and I have donated the stem cells. Now this will be the preservation time, where while the person needed, then till the time the storage will be taking place, the storage will be the frozen. You might have heard about the frozen plasma also in blood bank. That's how we froze it in the specific temperature. And when there is a donor and recipient, sorry, when there is a recipient, then properly will give the transplantation according to the norms. It's crucial to for the donor to inform about the process and the potential risk also. While if the patient is donating the stem cells to the person, so it should be legal consideration must be taken from throughout the donation process. So he should be aware of all the consequences. What should be the consequences after taking, and if the person is have taken the crucial steps, what will be the proper consideration. So the norms and the signature proper self consideration form should be signed by the donor itself. Now, if I talk about the stem cells are storage, it is stored through a process called cryopreservation. This is the process we call it, which will involve the freezing the cells at a very low temperature to preserve that with the viability for the long time. Okay. Now we'll be talking about what will be the whole procedure. I hope you people are understanding me because I'm very fast. Am I audible?
Yes, ma'am.
Okay, so these are the cryopreservation. Okay, the how it is being stored, and with what will be the whole procedure. Now this is a picture again how the freezing will take place. The stem cells are being frozen. Okay. Now let's talk about the donor selection. Now see, everybody is not being well, so they can give the proper bloodstream to the patient. So donor selection is carefully selected by the criteria of age, health status, and HLA, that is human leukocyte antigen. Compatibility should be there. Obviously, the compatibility test is being performed in the lab. Absence of the infection. For example, the allogenic, we'll be talking about the autologous and the autogenic transplant in further PPT. The donor may be may be a family member or unrelated volunteer. It could be anyone, but it should fall with the criteria of whether this person is having not any infection or he's not taking any medicine. The age limit should be there, same as like in we do in the blood bank while we donate blood to the patient. Okay. So, if I talk about the donor evaluation, donor undergoes throughout the medical evaluation to ensure that the health is okay and suitable for the donation. Stem cell mobilization. Before collection, the donor may receive the injections of growth factors such as GSF. So GSF is a protein which produce the new white blood cells from the bone marrow, if you people don't know, to stimulate the production to release of the stem cell from the bone marrow into the bloodstream. So this is the stem cell mobilization, where the collection would be done, the injection would be inserted to the patient so that the proper involvement of the stem cells we need from the patient to get evaluated for the patient for the patient itself. Okay. And if I talk about the contractidations, certain medical condition may be prevent someone being donor, such as history of cancer. If he has a history of cancer, autoimmune disease, and the infection or the cardiac or the pulmonary issues, so donor must also be in a good overall condition. It should not have any problem to him. There should be no complication of the infection, these whatever the disease has been mentioned here. So he should be proper in the transplant center should be within the proper criteria. Now, what could be the complication? Now, I have told you in starting that there will be a complication after donating the sampling. Okay, so these are the complication, that is graft failure. Graft failure occurs when the transplant stem cell do not engraft and produce new blood cells as expected. So this could be happen at the various conditions. So graft rejections is an inadequate stem cell dose underlying the disease, where the graft, for example, I am a donor and I'm donating a stem cell to the person, but my own transplantation cell blood is not being engulfed properly to produce a new cell, and I'm donating to the person, it could come in the graft rejection. Okay, so graft versus host disease is commonly complication of a allogenic. So I'll be talking about this, where we'll be taking about the donor immune. I'll be talking about this in further. The differentiation would be seen. But if I talk about this disease, it is affecting the skin and liver and the gastrointestinal fluid, where the acute means typically occurs with the first few months. Okay, and the chronic will take place at least for months and years. It could be range between mild to severe. So require a treatment in the immunosuppressive medicines, where to process with the, so it is being processed with the suppress the immune response and reduce the inflammation. So these are the disease, and graft venous host disease is affecting the skin basically, while it could be of two types, that is chronic and acute. I have told you about it, and these are the complications while it take place after donation of the stem cells. Now, let me talk about the storage, the freezing. Now, these are the steps for storage. Now, how do we store it? For example, I talked in previous also. There was a specific temperature we need for the storage. The freezing, the stem cell suspension, all along with the, these are the gratitudes which has to be taken by minus 196 degrees Celsius, that is minus 321 Fahrenheit, degree Fahrenheit, using a controlled rate freezer. We need the proper cooling process along the cell's edges to minimize the potential damage. So why do we need to freeze it? So that the stem cell suspension should not get affected, and it should be in the same morphology during the donation also. Okay, so the storage, once the cell are being fully frozen, for example, if I talk about even in plasma also, we give plasma platelets and cell to the patient when there is a requirement. Okay, before requirement we can't give the proper demonstration for the whole lab is there, where proper storage procedure is being done. Okay, so same here also, the storage for the cell are being fully frozen, they are transferred from the storage containers to the vials and bags, and they are specifically given with the called nitrogen gas devors. So these are the tanks maintained to extremely at the lower temperature to keep the stem cells in the state of suspended animation, preventing any further metabolic activity or the degradation. Means we do not need to degrade the cell, because we need the proper morphology after inserting the same stem cell to the patient, because obviously the patient stem cell is not working in the working condition. We That's why the transplantation is there. If the transplantation of the donor will be the same, then it would be a problem to the patient. So we need to freeze it first. The storage and the freezing method should be appropriate, so that the proper demonstration for the patient should be gone properly. So this is the picture where I have got, this is the procedure where the proper frozen, you can see even the steam is coming, so how much the temperature would be there, it's in minus. So you will see the monitoring. Now we'll be talking about the monitoring. Obviously, it's not that you have kept these stem cells in the storage and you will forget about it. We need to monitor it. Stem cell storage facility regularly monitored at the temperature and condition of the storage tanks, so that the proper viable and interact over the time. Backup system and the protocols are often in the place to mitigate the potential potential risk of the storage failure. For example, I'm a technician and I have stored the cell in it, and I'm not looking after it. And what if the machine tends to get the good, not minimizing with the same temperature because of the any failure? So it could be also the condition, we need to monitor it first. Okay. Thawing and use, how does it being transplant when needed from the transplantation? The research, the stored stem cells can be thrown and prepared for use according to the specific protocols. We have the protocols to even giving the transplantation to the patient. Throwing must be carefully controlled to minimize the cell damage and maximize the cell availability. Cryopreservation allows the stem cell to store from the years and even decades, providing a valuable resource for the future treatment and research. So it could be in the future research means, it could be possible for the research purpose also. We need for the PhD students, if the research is there, if they need this cell, the proper storage has been done, and then it has been given to the further applicant. And if I talk about the valuable source treatment, future store resistment treatment, sorry, the cryopreservation allows stem cells to store it for the decades. So we can take it for 10 years also, we can store the stem cell for the viability. Now, if I talk about, as I told about conditioner therapy, we have the autologous and the allogenic, HSTC. So in autologous, what is happening, and in allogenic, what is happening? So we have the two aspects here. We have the two therapies, how the person is being transplant. So we have talked about the procedure, then the storage. Now we are talking about how these transplantation is being processed. So we have the two types here, that is autologous and the allogenic. So autologous, in autologous hemopoietic stem cells transplantation is the patient of the own stem cells are collected usually after the receiving chemotherapy or a radiation therapy to destroy the cancerous cell, and these collected stem cells are then reintroduced into the patient body to regenerate the healthy blood cells. Now for example, I am a person and I'm having a cancer. Okay, so in cancer we go through the chemotherapy and the radiation therapy. For what we will do in the autologous, what, for example, I'm the first, I will be the collection will be there of the own stem cell. My own stem cell will be collected, and they will be after reintroduced after when the regeneration of the healthy stem cells will be there after chemotherapy. Okay, so for example, I am a patient, my own stem cells will be regenerated, and then it will be introduced to my body. So my whole criteria here will be, the therapy will be of only one person here. For example, I am talking about me, and me. I'll be the only, means auto means me, about one person. Okay, allogenic means they are being collected from the donor, receptant, and the whole therapy will be after. For example, I'm a patient, I'm having a cancer, now the donor will be coming and he will be donating me the stem cells. So this is the difference between, and you can see this picture also. Autologous means a person who is carrying his own stem cells, and the allogenic means the donor will be giving to the patient. So I hope you get this lecture. Any questions, if you people have, may ask please.
Yes, students, any questions? Yes.
No.
All right. Okay. Ma'am, it
Okay,
was
thank
a
you so much.
really nice session, ma'am. And when you are discussing these things, some things struck in my mind. I would like to share those also. Can I, ma'am? Yes.
Yes, sir, sure.
Yeah. Yes, students, listen, this is really interesting that how we are donating stem cells to the patient, right? So listen, how we are collecting cells in the donor first. How we are going to collect, if I want to give you blood, I'm a donor, and how you will collect blood from me. Okay. For that, what we will do is, literally we are giving some tablets. These tablets will increase the stem cell production in the bone marrow. Okay, since we are
Yes.
collecting bone marrow stem cells, I will introduce some tablets. These tablets will increase the blast cells, and those increased blast or stem cells, hematopoietic stem cells, will be released into the circulation. So This released stem cells are released into my blood, and we will collect these released stem cells from the blood. That means the second phase, first we are giving tablet to the patient. For 5 days, we are giving this tablet. This tablet is called as filgrastim. I just saw in online. Now, this after giving this tablet for 5 days, we got stem cells. Now, these stem cells will be separated from the blood cells. How we are separating? As ma'am stated, there is a special machine called what is this? Apheresis. So apheresis is it's a type of centrifuge where it will separate the stem cells. Okay, it will separate stem cells, and we will go for transplanting that in the patient. But when I was under this dosage, when I was under the dosage of filgrastim to enhance my stem cells, to increase my stem cell activity, this tablet can also induce possible cancer activity in my bone marrow, because this is enhancing further growth of cells. There is normal growth of my cells, and this tablet further boosting my growth of cells. That can also cause cancer in the donor. So that is why there is a risk of giving blood also. There is a risk of donating blood even after matching with HLA, because the side effects of these tablets. That's why we always will take the informed consent from the donor before giving this therapy. Not only for the patient, even from donor we need to evaluate. We need to see the donor healthy status, whether donor has any previous cancerous activities, donor has any infections, is donor have any bleeding disorders. These needs to be done. When we suspected any such problems with the donor, better we won't take his samples. Even though he is matching with the patient HLA, still we should not go with this one. Okay. Yeah, that is one interesting thing. So there is a chance of cancer during to the donor during this transplantation. And something I saw, 1 second, let me see one more. Yes, as ma'am stated, we are preserving the cells, right? We are preserving cells at -degree centigrades. Okay, at freezing temperatures, we are preserving the cells, and this preservation should be done in a very careful way. You just imagine, students. Uh, I was freezing you. I freezed you for 10 years, and I will refreeze you. I will make you again warm, and you should be alive. That means my freezing should not kill the cells. My freezing should not kill the stem cells. That is one of the deepest or the depth or the advancements we have done in preservation of stem cells. We need to freeze them in such a way that they will be alive again, even after 10 years. So that we achieved by a wonderful molecule called a preservative called I saw DMSO. That is called as dimethyl sulfoxide. So dimethyl sulfoxide is like a water. Okay, it's a preservative. We will suspend the cells in this dimethyl sulfoxide DMSO. If we suspend in normal water, then 1 second, let me mute you. There is let me mute everyone. I'm getting sound from Priyanka. Okay, so what I'm saying, if we suspend cell in a normal water and if you freeze the water, this water will make some needles like spikes. Okay, the cold spikes will be formed. Needle like ice spikes can be formed, and this ice see here. So this ice spikes can kill the cells. So we need a such type of water that won't make these needle like spikes. The spikes that will kill the cells, and hence we came to this wonderful molecule called DMSO. This DMSO, even at freezing temperatures, it won't damage the cells. Okay, so that is why we are using this DMSO for the preservation. And also some tablets will be given to the donor before collecting the sample, right? Before collecting the stem cells. So we will give 5 days of filgrastim and growth stimulating some tablets, as ma'am said. So with the help of this, we are doing, but still stem. See, these therapies are risk oriented, and the chances of survival of patient is very less. But compared to a death by a cancer, a leukemia, it is better to intervene and do our level best. Okay, our level best in saving the patient life. And the only one thing that is available to treat cancers currently is only stem cells. It is only stem cells. They are having the beneficial therapeutical output compared to the other chemo therapies or irradiation therapies. So that is why we are prioritizing stem cells over other therapeutic approaches, because of their viability, liability, and also their trust and safetyness. Considering these factors, we are still promoting stem cells as the ideal candidate for therapy for any cancer patients. I think, yeah, this will give you further knowledge. Any more questions, students? Any more? I guess no more questions. Shall we end this lecture? Yes, students?
Yes, sir.
Yes. Thank you. Thank you so much, Vanshika ma'am. It was a really wonderful lecture. You covered everything and it was an insightful lecture, ma'am. Thank you so much. Everyone
thank
join back at, yes, ma'am. Okay. Everyone join back at 2 o'clock, students. Meanwhile, please fill the attendance sheet. Okay. Thank you so much. Everyone can leave now. Fill the attendance sheet.
Thank
Yes.
you, sir.
Yes.